Another publication recently came out describing research done at UCLA showing medical records indicated a significant increase in clinical pulmonary infections with people showing up at the hospital with heavy coughs, for example. Numbers of visits to the hospital had spiked as early as December. These data were correlated with findings from other locations, such as England, and some of these patients were revisited using their autopsy tissues and found to have the virus. Now that we have a test, we can do this kind of retrospective research. Back in December and January, there were no tests, and in the US, we just didn't know anything about it. The UCLA study suggests that the virus was circulating at low numbers in the community. There may have been a very great incidence that was missing because the numbers of hospitalizations for influenza were increased dramatically. But most influenza hospitalizations don't undergo a test to see that it is influenza. The first wave of influenza was the B strain, which showed up in December. It may have been very likely that the increased frequency of the influenza B was actually COVID. The importance then of a vaccine cannot be understated. We must say it very loudly and understand it's important to take. The effectiveness of the vaccine is being studied, whether the vaccine works and for how long is being studied, but a vaccine is going to be what will save the community.